welcome back to Patient Win Insider. I'm Nick Moen, and today I'm joined by Treneice Negron from SOTA Cloud. Treneice has a rare background in dentistry, which is why I wanted to have her on. She started Chairside as a dental assistant inside large DSOs and worked her way into cloud-based imaging technology with SOTA Cloud. Today, she sits at the intersection of clinical reality, patient experience, and modern dental software. So we're going to dig into what breaks inside dental practices, how imaging is evolving, and where technology is actually helping versus just adding noise. Let's get into it. Thanks for coming on, Treneice.
Thank you for having me, Nick. It's such an honor to be here.
Awesome. Well, so your background was chair and now you're cloud side. So walk me through that transition. Like what was your experience working chairside at the DSOs, and how did that help shape the way you're seeing technology today?
Yeah, I like to think dentistry chose me, and having the opportunity to work in places like Aspen, Greenberg Dental has been awesome. I started out in Aspen Dental where I was a jack of all trades, just being anywhere I could be and provide some support. And that gave me insight into oral surgery, endo, and just general dentistry altogether. And then I had an opportunity with Greenberg Dental to work alongside a dentist that was taking on dental medicine. So, sleep apnea. So I had some exposure to being on the medical side, the dental side, and kind of colliding worlds together. And once COVID hit, unfortunately, things happened to part, but not so unfortunate because it also gave me the opportunity to get into software.
Cool. And so what is your role at SOTA Cloud now? How are you helping that? How are you?
Yeah, so I'm an account executive. The way that I provide support here is being able to go to conferences, educate dentists on how our product streamlines their workflow. In most cases, you have a lot of sensors that are on the market. So having a mix of sensors and a platform that's going to fully support, and then just overall having a streamlined workflow, reducing the amount of clicks to actually get through a program, not having those, as you mentioned early on, all that noise of getting from one end to the other, giving you everything you need to at the point, in your fingertips, at your fingertips, excuse me.
Yeah. Well, and kind of your understanding of like dental software companies is pretty expansive now. What do you think that where do you think maybe that some of the dental software companies fall short with real life in the dental office?
Yeah, I mean, that's a great question. I think that where they fall short is not really considering, again, how many clicks it takes to get into the capture process, the amount of time that the patient's in the chair. We're all patients, so at that point, you're already scared to actually get a service done, and one of those fears is also taking X-rays. It's really uncomfortable if you think about it. So we like to streamline that process. They're already in that experience. We want to build that trust, getting them in and out of the office, and having the doctors really be able to rely on a software that's going to get through their patient schedule. They have a busy schedule. The least that they want to worry about is software.
Yeah. And so aside from busy schedules and your experience chairside, like what were some serious pain points other than, maybe beyond x-rays and where SOTA Cloud helps? Like what were some like serious pain points or bottlenecks that you saw during the process?
One thing's for sure is being able to share images with referrals. A lot of the times you have to encrypt the data, send it out. And with that in mind, SOTA Cloud already has all those key features embedded in the software. So it's easy to go ahead and share referrals, HIPAA compliant portals, being able to also send images to patients with ease, educating these patients, especially utilizing AI. Those annotations are available within the portals. So it makes it easy for patients to understand exactly what's been recommended and really get started in trusting the doctor and completing that service.
Yeah. And I mean, you're giving demos on SOTA Cloud to some of your accounts, right?
Yes.
And what do you see? I mean, of course, there's a ton of, and I've talked to a ton of dentists, practice owners, doctors, entrepreneurs that are building out their own SaaS applications or technology to integrate into the dental industry. But maybe sometimes the demo's good, but in real life or in practice, some of these platforms might be falling short. Like, what's the feedback loop going from what some of your accounts are looking for with the software or the experience in the software, and how do you make that a reality? What's the internal method in your team to help improve the software?
Well, a common question is going from server based to cloud based. Being completely cloud based and under basic Wi Fi speeds, it being efficient, being able to be in and out of the office at any time and still being able to get on a cell phone, iPad, and look at these x rays with ease. If they're busy traveling around and they have associates that are providing service, at any point in time they could reference back to them and support them being remote.
Yeah. And so, I mean, it's a huge bottleneck, especially with multi locations or DSO environments. Where do you see like the best use case? Like, if you're going to convince somebody, hey, moving to cloud based platforms is the way of the future, where do you kind of find the most convincing argument for that?
It's synchronizing the database. It's being able to have a patient go from one place to the other, having their images instantly available. And especially when it comes down to CBCTs, you're going to have to download them on a CD or thumb drive, but now you have the ability to just be able to log into the system, have it readily available at an instance.
And then, as far as interacting with the images afterwards, what's the experience there?
Easy peasy, because we provide such high-end tools that allow you to filter these images. We do have the ability to integrate any sensor, any intraoral camera. So with that in mind, you're getting quality for what it's worth.
And you integrate, what integrations do you currently have with SOTA
So
Cloud?
we're an open platform. We like to say that we're open to all of the major practice management softwares. You can use any sensor with our product, any intraoral camera, any panoramic, and also any CBCT.
And some of these new integrations are platforms that are based on some sort of AI technology, right? Have
Yeah.
you noticed, or what's your opinion of that? Like, have you seen it helping a lot? I mean, maybe like Pearl or Overjet?
Absolutely. As a dental assistant, learning films, going to sensors, and seeing how well each Vidya, Pearl, Overjet has tooth parts, breaking down the anatomy of the teeth, being able to see measurements at a glance, having the provider really see things from a different perspective. They're seeing all the things that they normally would, any areas of improvement for the patient, but also just taking it to an even further extent of educating these patients.
And what does that look like? Like, have you seen kind of trust break down in this part of the process with patients?
Absolutely. I think when you see the anatomy of your teeth and you actually realize you're taking accountability for it, you have these red linings that are indicating, this is the reason why you're experiencing this sensitivity, more or less why the doctor's providing a recommendation for that service.
Do you think it can be overwhelming, like integrating some of
Oh,
this
yeah.
technology for them? And because I mean, I've obviously seen X-rays of my teeth. I haven't seen them in AI platforms like Pearl or Overjet, and or SOTA Cloud for that matter. I mean, how does that patient experience change? I mean, do you think that helps with like case acceptance and
I think it builds trust. I think it's a second opinion. It's giving the patient the idea that they're not just seeing black and white images, they're getting educated that these are your teeth, this is the reality of it, and it's totally up to you to go ahead and get that recommended service. It's not only a suggestion from the provider, but also the fact that the AI tools are detecting this for you as well.
yeah, and working with DSOs, I mean, who are the primary clients for SOTA Cloud? Where does some of this cloud-based technology really thrive? Is it
Yeah, so
DSOs or single location practices or
it's both. It's DSOs, single locations, friendly qualified health clinics. We have DSOs by the name of PDS, West Coast Dental, Apex Dental, and then we have our solos as well, ones that are coming into mid-sized market and growing. And we want to grow with these practices.
right? So growth, we're looking at the future, right? Where does SOTA Cloud headed and kind of your experience and integration with SOTA Cloud? Like where do you see the technology and SOTA Cloud going in the next 3 to 5 years?
Well, even just this past year, we've incorporated CBCT use, device health monitoring. It's constantly evolving, and that's the best part about it. I like to think that just like we went from films to sensors to intraoral cameras being required, that's going to be an all-in-one solution for you as we continue to strive in dentistry.
What do you think as far as scanning technology goes? What do you see being kind of the game changer in scanning technology?
That's a great question. I think with scanning technology is just like AI in a way. You're able to see things in a different perspective and be able to provide much more quality service because, especially with 3D scans, you're seeing an in-depth concept instead of a 2D image.
Do you have like a favorite 3D scanner that you're working with where the SOTA Cloud really excels?
No, I think everything's kind of treated equally, just like with sensors. We like to think that these providers entrust the product that they're using, and we're here to support them.
And is it easy for the patients to be able to see the scans and understand what's happening in the scans, and who's walking them through that mostly?
Yeah, in most cases, there's CBCTs that are kept separate from the operatories. So at least with SOTA Cloud, you have them in each operatory. The patient's comfortable in the chair, being able to see these scans in real time and continue to have that quality care. You have your CBCT, you have your 2D imaging, you have the AI overlays. It's kind of how hitting you at once, but it's also a good experience for you to see it from all different perspectives.
And do the patients with SOTA Cloud, are they able to access some of this data or the scans independently, or is this really an internal thing?
So the CBCTs are kept internal, but that's more on the sense of if they need to refer it out to providers, those that can be accommodated. But as far from a patient case use, if they happen to leave the office, they're requesting their images or what have you, they'll have an actual portal that's dedicated to them for all their 2D imaging, and those AI overlays are embedded in there as well.
Do you have a sense? I mean, going to all these conferences, is there anything that's really jumped out that's changing in the dental industry? I mean, maybe with scanning or cloud-based data processing or something aside, like what's really exciting to you right now?
I've always been a huge fan of iTero scans because those specific scans are going even in greater depth of really educating the patient because they're seeing a complete scan of their mouth in real color and seeing exactly what's needed. I think as a patient, when I got my first initial scan, or even just going through being a dental assistant and learning how to scan, that stood out to me like a sore thumb because, again, we're going from 2D imaging, we have 3D, and then you have those scans that you can actually see full throttle of your entire mouth. And I think that's what really brings out that quality of care of wanting to take better care of your oral hygiene.
Yeah. And how does SOTA Cloud stand out with some? I mean, there are other cloud-based softwares that, kind of maintain or manage some of the patient information and data. Like what really stands out about SOTA Cloud?
I think what really stands out about SOTA Cloud is that they take their security parameters with great care. Our CTO is very much involved with how it's structured, how it's encrypted. It's providing quality service of respecting HIPAA compliancy and building that trust not only for the practice but for the patient.
And what's the onboarding process like? Like, are there things that you've learned working with accounts or clients that you think are working really well with onboarding and training? I mean, adding new technology can be pretty overwhelming sometimes, right?
Yeah, well, fun fact, I was an implementation specialist before I was an account executive. So, with that real experience, it's a 2 week process, it's 3 meetings. You do the installation with our support team. We ensure that your image quality meets your expectations before you go live, which is very important, especially when you have a mix of sensors. You want to ensure that all the sensors are working to the best of their abilities. And as we're capturing images, the best part about having image quality met is that you're reducing the amount of time that you need to filter out the images.
Is it hard? Go on, go on.
I was going to also say that there's training led right after that. So with training, it's a tailored experience. The staff is able to ask questions both front and back. It's really important for them to understand how, just as you mentioned, it's a new product. It's something that, they have to learn. So it's exciting for them to get on a training session, ask the questions that are really pertaining to their workflow and how we're making it easier for them.
And as far as convincing offices that they need it, I mean, what's the short pitch in saying, hey, look, this is going to change, workflow or reduce patient friction, or where do you really settle in saying, hey, this is something that you really need?
I like to ask questions. I like to ask, how long does it take for you to go ahead and send out images to a patient? Do you encrypt those emails? How long does that take? And then showing them that we can reduce that time. We also have what's called exam analytics and staff analytics. We're tracking performance on how quickly we're getting through these x-rays and if we see any opportunities for improving that performance, and we encourage the practice to utilize those features because that's going to help them become better at their workflows. And incentives, always incentivize these new improvements for the staff because it's going to help everyone.
What's the incentivization program look like?
Well, that's always internal. We just suggest that they utilize the features and incentivize the team to build that trust that they're seeing their results and that they're improving.
And are you working with dental assistants or people that are chairside that are, actually implementing the SOTA Cloud platform? And I mean, are you hearing glowing reviews about how their experience is with it?
Yes. When I go to conferences, it's great because we get to have that retention with our clients and see how well it's performing in the office. As of recent, we went to ADOM and all the office managers were raving about how the staff really enjoys the product and how easy it is to use compared to what they were using before.
What were some of the platforms that people were using before that that SOTA Cloud's able to kind of come in and revamp?
It's a variety.
Yeah, and so what about film?
Yeah, the film too. I mean, there's very sometimes I get really surprised that there are some offices still out there that are on film, and it's exciting to go ahead and evolve that and transition them into something more modern. And we don't
Yeah,
like to take away from other softwares. We're not, of course, we're competitors, but we're friendly competitors. And if we have a product that happens to fulfill them a little bit better, we're here for that need, and vice versa when they want to resort back or things like that. We always respect their decisions.
yeah. And so it's really like an augmentation of the process, right?
Exactly.
Cool. Well, hey, Treneice, thanks so much for coming on and sharing more about SOTA Cloud and your experience being chairside and how technology is changing and how easy it is to adapt to it. Making the practices flow better and the patient experience even more robust and rewarding at the end of the day.
Absolutely, Nick. Thank you for having me. It's such a pleasure to be in this space and continuing to see how technology evolves.
Amazing. All right, until next time.
Until next time.